On Wednesday, Minister of Health confirmed 2 more cases of coronavirus in Uganda, both Tanzanian truck drivers who arrived in the country through Mutukula border. All Uganda's last 8 confirmed cases have all come from truck drivers arriving either through Kenya or Tanzania. Of these last 8 cases, 1 is Ugandan, 3 Tanzanian, and 4 Kenyan nationals, bringing Uganda's cumulative COVID-19 cases to 63. These imported cases have raised fear among the National COVID-19 Task Force, undermining the elite efforts towards the minimal spread of the pandemic. Minister for Internal Affairs, General Jeje Odong, says the National Task Force is studying possible remedial actions.
Deploying of rapid testing kits at the entry points so that the driver knows the status before he leaves the border. The rapid testing kits, I am told, give results within 10 minutes. So testing, using the rapid testing kits, enables us to know the status even before the driver has left. However, I want you to note, each test is $65. On average, 1,000 vehicles enter Uganda. If we assume from the original instruction that each vehicle should have 3 people, that is 3,000 entering Uganda on a daily basis. 3,000 times 65 is $195,000, an expenditure on us on a daily basis. This might be prohibitive.
So, what could be the other possible solution?
If a vehicle is coming from Mombasa, for example, that driver will drive up to the border, Malaba or Busia. He will stop there. We sanitize the vehicle and it is handed over to his counterpart here in Uganda. His counterpart will drive to the final destination if it is in Uganda, or to the border point of exit to the country of final destination. He will also leave it there and another driver takes over. We are looking at that possibility. We will discuss it with the stakeholders. If it is applicable, then certainly we will employ it.
He was addressing the media in Kampala. In the meantime, resting places have been designated to prevent truck drivers from interacting with the population. World Health Organization encourages sensitizing truck drivers.
Yesterday, the Kenya announced that it is going to screen their cargo crew. So by them making sure that their cargo crew is not transmitting the disease, we are also making sure, and Uganda and the other nations doing the same, we will make sure that the economy goes ahead, trade goes ahead, and disease is not transmitted through that method.
Already there is a policy in place where the ministers for trade have been in dialogue amongst themselves, and they've come up with a strategy on how to handle truck drivers and trucks that crisscross the borders.
All border communities remain vigilant. The problem still lies on public attitude on containment measures.
It is very surprising and even disappointing that some of the elite view the containment measures as a punishment, and therefore their compliance levels are low. They have begun to say that since there is no person who has yet died in Uganda because of COVID-19, then this disease is not serious. Really, if you look at what is happening elsewhere, people are actually dying in thousands. So it is disappointing for someone to say it is not serious.
Uganda's anti-coronavirus response is gradually drawing international admiration and recognition globally, given the speed of recoveries and management of confirmed cases. At least 7 recovered patients were discharged from Entebbe and Mulago hospitals on Wednesday, bringing the number of recoveries to 45 cases and 18 active cases. Bernard Yiga and Daniel Mugoya, UBC.
Cover your mouth.